Hi, my name is AJ Nafso. I'm the owner, founder of Bloomfield Hills Dental Associates. We currently are operating out of a 16 operatory clinic. There's myself and 4 other dentists that work out of this clinic full-time, and we have 7 full-time hygienists. We roughly employ a staff of about 30 within the practice. Listen, as a dental practice, we've tried really hard to find a marketing company, and Rise DDS was the only company that actually provided deliverables for us on a regular, timely basis, and we actually saw the results immediately. I'm a graduate of the University of Iowa Dental School, came back here in '92, and this is my hometown, and did a residency down at Receiving Hospital, Detroit Receiving Hospital, for anybody that's local. Did that for 2 years, and then afterwards started private practice. Some of the things that I did do during my first couple of years of practice was to find specialists that would allow me to hang out with them 1 day a week. So my day off was spent with either an orthodontist, a periodontist, endodontist, or an oral surgeon. That was my goal, just to kind of spend a day a week with them, and I'd work from the bottom up. So I was their scrub nurse, I was their orthodontist. I took all the records and the models and whatnot for their patients, and then I just kind of after I developed the trust with them, to kind of hone my skills, and then I started doing it on my own, and then these people actually became my mentors as I started practice. Again, years ago, 3 operatory clinic that I purchased from a lady, which had a couple hundred patients active, and then my goal really was just to target niche patients and niche organizations in my area as far as being their provider. So that was kind of my thing, and I really tooled my office around their needs. So my hours were set around their needs, my staff was set around their needs, and that's kind of how over the years I've been able to build a practice of this size. So now we are at the 12th year where we have 16 operatories, and at one point in time we were probably one of the biggest clinics in the state of Michigan. We are not that any longer, but I think most of the people nowadays are looking at a couple of different facets of dentistry, right? One is marketing, how to attract new patients, how we've been able to attract new patients. And so over the years, I've tried different types of marketing. Marketing from mailers to TV commercials to online presence through social media marketing, those kind of things. Everything that's come along the way throughout the years that you kind of want to jump on to see to attract new patients. Initially on, when I was first starting out, it was all just internal marketing, right? You know, kind of market the patients that you currently have and get them to refer some patients, but that's, you know, again, the climate has changed a little bit from that. Most of these companies will come in and, which you guys probably have heard if you've tried this, right? The first thing they come in is they say, well, your website sucks. It's no good. Your phone skills are no good. Your staff needs to be retrained. Just a laundry list of things that they're going to come in and say that they can improve on. And, you know, initially on the first 1 or 2 of these marketing companies, you're going to jump on board because you don't know. Right? And I will tell you that thousands of dollars later, time wasted. I think that's the biggest facet, is time, because you were sold that you were going to get X number of patients per month if you spent this much, and you did X, Y, and Z as far as updated your website, updated your social media presence, those kind of things, and that just never materialized. What I can tell you with Rise DDS is that you know, again, I'm not going to tell you that it's seamless. It's not. It takes work, but the deliverables are there. I think the biggest thing are deliverables. Other companies, you spend a lot of time, energy, money, but no deliverables. And I think that's kind of my journey over the years, and why I've stuck with Rise DDS over the last few years is because of the deliverables. And I think that's where that's the separation. Nowadays, it's much more difficult to hire qualified staff. They're just not out there. So the game now is retention, right? If you have good staff, how do you train that staff, and then how do you retain them? And really that just starts with a conversation, right? What are they looking for? What do they want? You know, for most of these staff members who are dental assistants, dental receptionists, dental hygienists, this is their career of choice. They're not going on, you know, they're not, for the most part, in college going on to bigger and better things, so to speak. So this is going to be their career until they retire or they stop working. So you want to give them a chair at your practice that makes sense for them over the long term. We always say that the receptionist is the first person that patient sees as they walk in the door. and for the most part, the last person they see when they walk out of the door. And so we want to make sure that they have a say-so as to, you know, the type of patients that are walking through the door. We're just not taking everybody in there if they're not comfortable with those types of patients coming through the door. So that dictates the type of insurances we accept. It dictates, you know, our cost structure, those kind of things, our hours of operation, and it just makes them feel comfortable when they're here, so that we can provide that therapy for those patients. And that's kind of helped out a lot for us. We implemented a few other things as far as retention, as far as education, and we also talked about bonus structures and hitting certain numbers and parameters. And then that comes back to marketing, right? And what we try to do with the marketing and working with Rise DDS is to create some kind of a culture with regards to our patient base, right? What kind of patients do we want to go to, attract, treat? Those things are all very important to us. And I think Rise DDS does a really good job as far as understanding what culture we're looking at here, how we're trying to position ourselves in our community, in our area. They take a look at our current patient base and what that looks like and how we can build from there.